Innovation is changing healthcare and saving lives. Today I'm at Alert Comprehensive Specialized Hospital and I want to talk to Dr. Abdurezak, who is a plastic reconstructive surgery specialist and microsurgery subspecialist. It's a pleasure to come here and see the innovation that you guys have here. So I would like you to introduce the machine that we have and tell us more of its capabilities.
First of all, I would like to say thanks for having me. And recently we have a new cutting-edge microscope, which is very useful in reconstructive microsurgery. So our microscope is capable of magnifying things up to 12.5 times. So this is very helpful, specifically in reconstructive microsurgery. Tiny tissues that are found in our body, like blood vessels, the nerves, and also the lymphatic system. So basically, microsurgery is taking part of a body or a tissue from one part of our body part to the another body part. Say, for example, if a patient has trauma on the face, tissue loss, or because of cancer, if a surgeon excises that part of the body, then that has to be filled. So that could be filled using the reconstructive microsurgery, in which you take part of the body, for example, from the thigh, you take the skin and the fat along with its blood supply. So that tiny blood vessels, which are measured in millimeters, it could be up to 1 millimeter, even less than that. So that can be reattached to the donor site, which is on the neck blood vessels, using this microscope. So the help of this microscope comes when you are making your anastomosis.
Yeah, so Dr. Abdurezak, so I'm aware you guys did some very breakthrough surgeries led by you. And how did you use this machine and how was it helpful? Was it before the surgery or after the surgery? Did you acquire the machine before or after?
Yeah, recently it was viral on social media that we have performed perianal replantation. And he was lucky because we have this machine. So that surgery was performed using this microscope.
Oh, okay, that's very good. Yeah. So what would you say was the impact of the machine on these surgeries?
Yeah, actually we were asking this machine to be purchased for the last, I think, 10 years. So we have a limitation, because if you don't have microscope, you don't have leverage. There are some cases in which you say this is inoperable, because if you excise that part of the body, it's not possible with classical, conventional methods of reconstruction. Say, for example, if on the neck there is a big tumor on the esophagus, after you excise, if you cannot make another esophagus, it will be very debilitating for the patient. So. But with the advent of this reconstructive microsurgery, you can reconstruct esophagus, say, for example. So this microscope pushed our limit, and there is a saying, sky is the limit. So in microsurgery, once you have this microscope, the sky is the limit. So you have a degree of freedom to do a lot of options for the patients.
Okay, that's really good. And then how many surgeries have you performed so far with the machine?
I think on average we are doing one case per week. Like for one case per week is a lot for beginners. In specialized centers they do 3 or 4 per week. So as a beginner, 1 per week is acceptable in my opinion. So far we started 3 years ago. So if you multiply it, it's more than 100 cases done by this microsurgery.
That's a huge impact.
Yeah.
Okay. And then how many so you're the main person operating it, or you have a couple of people working on it?
Yeah, I'm the main microsurgeon, but my colleagues are helping me because it's difficult to do everything. So you need to have a good teamwork. A microsurgeon by himself is not enough. Microsurgery is a teamwork. Not only your colleagues, the anesthetists, the nurses,
Okay.
They have to specialize. They have to know what is needed. The time it takes is very long. Anesthesia time is prolonged.
Okay.
You need a good ICU setup. So ICU nurses should be specialized in taking care of this patient, and also the ward patients. The ward nurses. So microsurgery is a teamwork. So having a technique by one surgeon is not enough. So all these staffs are equipped and able to help. Yeah.
Okay, that's really good. And then how many people do you think, like at full capacity, it can be able to serve? You said it's 1 per week that you currently do, but how can you stretch it?
Yeah. So we have short-term, mid-term, and long-term plans. So the short-term is to give short-term courses for our residents and fellows using celastic materials under loop magnification or microscope. In the midterm, we are planning to have live models like rats and the like. Within 6 months, I hope we'll have our own lab. So using live animal models, we can teach our residents and fellows. But in the long term, we plan to start microsurgery subspecialty. So the number of microsurgeons should increase to give more the service, reachable to wider population. Otherwise, only one surgeon to do 3 cases per week is very difficult, because it's taking 10 hours, something like that. And sometimes even you may have to come back. The patient is sent to the ICU or the ward. Something could happen, and there are some cases in which I come back again in the evening. So to make it sustainable, more surgeons should be able to be trained.
And then what are the use cases for this? Like you can name maybe 3 or 4 use cases of what you're able to treat and with this machine.
Mainly this is used for head and neck tumors, skin cancers, mostly the cheek, lip, or mandible. So these tumors will be excised in block. So after that, we have to reconstruct from multiple body sources. It could be from the back, from the forearm, it could be from the thigh, anywhere. We have a lot of options. And if there is a bone is lost, for example, mandible, then we can take from the leg, fibular bone, we can reconstruct. And the other very important aspect of this microsurgery is for trauma, specifically lower limb trauma. It's difficult to close with local flaps. So this microsurgery is very vital for this patient. So after the bone is exposed, you take soft tissue from the back or from the thigh, or you can take muscle to cover that defect. So by that you can avoid amputations. So mainly for the tumor, head and neck, and also for trauma. And also lastly for body part amputations, like hand amputation, finger amputations, can be dealt with this microsurgery.
Awesome. So last question is, what would you like to tell anyone who wants to venture to be like you, anybody who has a dream? What encouragement will you give them so that they join this field and just be like you?
Yeah, I think microsurgery is a very nice field. First, you have to study plastic surgery for 5 years if you are taking our curriculum. Then, according to my experience, you have to do 1 year of fellowship. I did my fellowship in Taiwan. So once you did that fellowship, you will be licensed to do this microsurgery. It's very rewarding field because it's a one-stage surgery. Sometimes with conventional technique, you have to do 3-4 times. The patient has to be taken back to the OR. But with microsurgery, ideally, it will be just one stage. You'll complete the defect or reconstructing that functional loss just with single surgery. So it's very rewarding, but also demanding, because it will take a long time, sometimes 10 hours, even more than that. And when they go back to their respective ward or the ICU, you have to get ready. The patient may come back again to the OR because there is a little chance of failure. It is said that the success rate is more than 98%, but there are some failures, so you have to take them back before you know that failure is ensured. So it's called salvage procedure. So we did some cases in my experience. So I think 3 or 4 cases were salvaged because we timely took them to the OR. So you have to know that it's also demanding. If you want to become microsurgeon, I highly encourage you to pursue your dreams, and it's very rewarding field. That's what I can say.
Okay, thank you so much.
Thank you so
Thank
much.
you.
Thank you.
Thank you.
Thank you.